Hello kids! Before we start our discussion, here are the objectives for today's lesson. Today we are going to explain the nature and objectives of first aid, list down the basic principles in first aid, tell the importance of giving first aid, and to know the basic first aid for injuries and common condition. Picture analysis. Take a look at the picture. What do you see? Okay, these are the basic things that you can see inside a first aid kit. Do you have a first aid kit at home? Now, what is the importance of having a first aid kit at home? Well, a first aid kit is your go-to for reducing the severity of the injury and preventing infection. First aid kits, you will find the supplies to treat cuts, burns, scrapes, sprain, and many other common ailments. Now, what is first aid? And what is the importance of first aid? First aid is an important tool in quickly responding to accidents to ensure that injuries can be efficiently and promptly dealt with before a trained medical professional arrives. Again, when we say first aid, it is an immediate and temporary care of help given to a victim of an accident or sudden illness before the services of a physician is obtained. Take note of the word immediate. It means done at once or instant. Now, accident. When we say accident, it is an unfortunate incident that happens unexpectedly, resulting to damage or injury. Injury, on the other hand, can happen to anybody, anytime, and anywhere. Accident or injury may happen at home, in workplace, in school, on the road, and in abandoned area. Victim. Victim is a person harmed, injured, had an accident, or other event or action. When we say action, it is the process of doing something, typically to achieve an aim. First aider. It is a well-trained individual and taken a course in first aid. First aider gives care with confidence to the victim or person injured. Now, let's talk about the nature and objectives of first aid. First, to prolong life or preserve life. This includes the life of the casualty, bystander, and rescuer. Second one is to elevate suffering or to lessen pain. Protect the casualty from further harm. Ensure the scene is safe. Provide pain relief. This could include the use of ice packs or simply applying a sling. Third one is to prevent further injury or illness from becoming worse. Prevent the injury or illness from becoming worse. Ensure the treatment you provide does not make the condition worse. Provide reassurance. It is important to understand that first aid has its limitations and does not take the place of professional medical treatment. Now, let's proceed to the principle of first aid. First one, first aider should ensure that it is safe to intervene. When we say intervene, is to interfere with something. Remember that your main objective is to save, preserve life, ease pain, and prevent further injury to the patient. Make sure that whatever you do will not cause further injury. Remember, do no harm. This does not mean doing nothing. If you are unsure about what to do or fear that you might harm the patient, call for help. Avoid moving an injured person, especially if unconscious, unless not moving them puts them at great risk. Do not remove an object embedded to the patient, like a knife or nail, as this may result to more profuse bleeding and greater danger to the patient. If you feel you might put the victim at greater risk, just call for help immediately. Second principle of first aid is first aider safety should consider first. The scene of an accident or emergency posed continuing danger not only to the injured but also to the first aider. If both were at the scene when the emergency occurred, it is possible that the first aider may have sustained injuries as well. It is important to assess the situation first and ensure that the place where the first aid will be given is free from danger. Otherwise, the first aider and the injured person can be transferred to a safer place. Before doing so, however, make sure that transferring will not result to more injury to the injured. Third principle, conduct initial assessment. Remember what you've learned in the previous lesson about the first aid. If the patient is conscious, check for airway, breathing, and circulation. While waiting for help to come, observe signs, symptoms, and details of the patient's condition. Check for possible bleeding, broken bones, and pain that the patient might be experiencing. If the injured person is conscious, ask questions about how he or she is feeling and other information that might be of help to the medical professional when they arrive. Fourth principle, take immediate action. What you do before the arrival of the medical professional during an emergency situation can sometimes mean the difference between life and death. Take immediate action, but do not panic. If you have called for help and waiting for them to arrive, return to the patient and see how you can alleviate his or her suffering. If medical tools and equipment are not readily available, you can always improvise. For example, you can make a bandage from a clean dress. The victim may feel scared or start to panic. At the very least, you can assure the patient that help is coming and help him or her to relax. Next principle, get help. Seek professional help. Remember, the first aid is just temporary care given to the injured person. It is always important to get professional medical help as soon as possible. First aid has its limitations and does not take the place of proper medical care. Proceed to the hospital or see a doctor immediately, especially for a serious condition. Now, let's talk about the different basic first aid for common injuries and conditions. The first one is wounds. Wounds are injuries on the skin and body tissue. Basic first aid. If a person gets wounded, it is advisable to perform first aid by cleaning the affected area of the skin. In addition to this, if the bleeding wound is on any of the extremities, keep the affected part at a position higher than the heart. Doing so could help slow the bleeding. Next common injury is a nosebleed. Nosebleed caused by hypertension due to increase of temperature or heat from the environment. Basic first aid for nosebleed. Let the victim sit on the chair, lean him or her slightly forward, then press the soft part of the nostrils. Additional information for nosebleed. If the bleeding does not stop after 10 to 15 minutes, keep a constant pressure for another 10 to 15 minutes. If the bleeding persists, seek professional medical help. Next one, burns. Burns are injuries caused by exposure to chemicals like hydrochloric acid, hot liquids, electricity, fire, and sun rays. Basic first aid. You can place a clean cloth over the burned area. Avoid breaking any blisters to avoid infections. And you can place ice packs on the affected area. Burns are classified according to the degree of damage. We have first-degree burns, second-degree burns, and third-degree burns. First-degree burns, these are burns in which the surface of the skin is reddened and painful. Example, sunburn. For the second-degree burns, are surface burns in which the second layer of the skin is affected, resulting to blister and reddening. For the third-degree burns, these are burns that damage the outer and underlying tissue of the skin. This one needs medical attention. Next, food poisoning. It is caused by consuming contaminated foods and expired canned goods products or other products. So most of the victims of poisoning are children. Poisoning is the effect of swallowing, inhaling, or absorbing harmful substances on the body. Basic first aid for food poisoning. Keep the victim's mouth and nose open by tilting the head. You can loosen the clothes around the neck and waist for better breathing. Ventilate the area and seek medical attention. For fainting, it is a sudden loss of consciousness due to poor blood flow to the brain. Basic first aid, ventilate the area. Let the victim lie down or bend over and lower his/her head to bring back the normal flow of blood. If the person does not regain consciousness after some time, open the airway, check the breathing, and prepare to give CPR. If the patient does not respond, call for professional medical help immediately. Next one is the musculoskeletal injuries. It includes bone, joint, and muscles injuries like fracture, sprain and strain, dislocations, and muscle cramps. For fracture, this is a break or crack in a bone. Basic first aid for fracture. Stop the bleeding if the fracture is open. Do not apply pressure directly on the bone and never push the bone back through the skin. Do not move the victim because there is a chance the spine has been injured. Next one, sprain. Sprain is an injury to the ligaments around the joint which may be stretched or torn. Basic first aid for sprain. Rest the injured part. Apply ice packs or cold packs on the injured area. Wrap the injured part with elastic compression bandage and elevate the injured part as much as possible above the level of the heart. For strains, it is an injury which is caused by the twisting or pulling of the muscles or tendon beyond normal capacity. Basic first aid for strains. Rest and elevate the injured area or part. Apply cold packs for the first 10 to 15 minutes. And seek medical help, especially for back pains. For dislocations, dislocation is an injury which is a result of the separation of two bones at joint, leaving the bone out of normal position. Basic first aid for this, do not attempt to set the two bones head. Provide support on the affected part and avoid moving it. Apply cold packs on the injured part to avoid swelling and seek medical assistance. There are common signs and symptoms of dislocation. We have bone deformity, pain, loss function of the bone. Next, muscle cramps. It is an injury which occurs when a muscle suddenly contracts, resulting to a muscle spasm, pain, and loss of movements. Basic first aid, gently massage the muscle with the heel of the hand to stretch the contracted muscle. And there are times when muscle cramps occur while swimming. In such instant, stay calm and tread water while massaging the cramped muscle and yell for help. Muscle cramps is felt frequently in legs and hand muscles. Okay, now remember kids, first aid is an important part of everyday life, whether at home, at work, or at play. First aid knowledge is commonly used to manage minor injuries at home, in school, or at work. Okay? So now, if there's any question or clarification, do not hesitate to message me via LMS. Okay, kids, and some few reminders. I'm going to unlock all the assessment or activities for our lesson in health today. Okay, including the go and learn, which is serve as your assignment, and it will be recorded. And then the quiz. The due date for the quiz is on April 27th. Take time to review the lesson that we discussed today before you attempt to answer the quiz. And then lastly is the project in health, which is the fishbone organizer. All the details are posted in the LMS. I just want you to read the instruction carefully. Okay? So again, if there's any question or clarification, don't hesitate to message me via LMS or in MS Teams. Okay? So that would be all for today, class. Thank you so much for listening. Have a great day ahead. Keep safe, everyone.